Okay, welcome to Module 2, Methodologies, and this is the first unit of Module 2, Common Qualitative Methods. I'm Leslie Carnahan, a PhD candidate in Community Health Sciences. So the learning objectives of this unit is to identify common research methodologies in qualitative research, to have a better understanding of the tools that you can use to investigate and understand health phenomenon. Specifically, there's different approaches that work better in different situations, so we'll go over that a little bit. We'll discuss the strengths and limitations of qualitative research, and then also by the end of this, you should be able to describe how qualitative research methodologies can be useful for promoting public health priorities. So a brief summary of the qualitative methods that we'll be talking about today is observations, interviews, focus groups, personal narratives, and then the photo voice. Observations, there's many different kinds. There's participant observations, written descriptions of things, video recordings, photographs, and other types of documentation that can be examined. Regarding interviews, sometimes also called stakeholder interviews, these can be informal, unstructured, semi-structured, or much more structured formal interviews, which those would be sort of like a survey instrument for very structured interviews. And then there's also focus groups, which are, these can be either in person. There's another method we'll briefly touch on called sequential focus groups, and then there's also online focus groups. Personal narratives may be things like written blogs or online forums or oral histories. And then photo voice is one very specific methodology. There's also relatedly techniques called photo narrative or photo elicitation. So getting a little bit more in depth about what an observation is, this is a systematic approach wherein researchers use multiple senses to examine people in their natural settings and in specific situations and contexts. So when I say multiple senses, this includes sight, sound, smell, sometimes even taste. And there's, again, multiple different types of observations that can be done in qualitative research. So the first, there's non-participatory observation, and this is when the researcher or researchers collects information, but without interacting or asking questions of the participant population. So this is sort of akin to the term, being a fly on the wall. The goal is to remain, not bringing attention, and so people, you're not actively participating. And then in contrast to that is a participant observation, and this is where the researcher or researchers, again, actively are engaged with a group or group's activities and the situation related to what they're trying to study. Observations can also be made via video recordings. Observations also include photographs, and this could be, just photos of physical spaces, appearances, advertisements, things like that. And then when I'm discussing documentation, that can be things like field notes, policies, reports, laws, minutes from meetings or from coalition meetings or something like that. So again, there's multiple techniques for observation. And then different from observations is, again, we have these interviews or stakeholder interviews, and these are direct one-on-one interactions with an individual to discuss a series of open-ended questions on a limited focused number of topics. So sort of when I talk about interviews, we're going to talk about them from the least structured to the most. So the least structured type of interview is an informal interview. This is generally really not distinguishable from a conversation. There's not necessarily any preordained or predetermined direction that the interview will take from the onset. And then the next level up is an unstructured interview. So this is a little bit, again, more structured than the informal, and you know, there might be a general health topic or something that is the purpose of the conversation, but that's not, and it's more flexible than a semi-structured interview. And a semi-structured interview provides a little bit more control to the interviewer, and this will have an interview guide, but this, you know, generally these are quite flexible, and they're not necessarily scripted word for word in terms of the interview guide. So there is flexibility about where the conversation can flow. And then the most type of structured interview or a formal interview includes open-ended questions and sometimes elicitation tasks. So a focus group is another qualitative methodology, and this is a group of generally 6 to 10 people, and it's a conversation that it has a moderator. So there's an individual who is leading the discussion, you know, posing questions to the group. However, part of their role is also to moderate the conversation that's happening between participants and individuals that are attending the focus group. And the objective of focus group is to collect high-quality data in a social context, and this allows participants to consider their own views in the context of others. So probably the most traditional type of focus group is one that you have heard of, and maybe you've even participated or moderated one yourself, is an in-person focus group, and this, again, the discussion is moderated by a facilitator or someone's called a moderator, and there's open-ended, predetermined questions that generally flow from focus on a few number of topics, and the conversation goes from very general questions to more specific. There's another type of focus group method. It's called sequential focus groups, and this is when researchers conduct a series of focus groups with the same group or groups of people over a period of time. So this is, again, you know, you might ask people to participate in focus groups, you know, at a baseline of an intervention, and then you might go back to that same group 6 months into the intervention, and then you might go back to them at, you know, 12 months after the intervention. And this can be a very useful technique to discuss especially sensitive topics, because it allows the group to become comfortable with one another as well as the facilitator. And then there's as you know, technology emerges and develops, so will qualitative research methods. So one thing with the internet and the ability to connect with people and be online 24/7 provides, again, unique opportunities for focus groups. So an online focus group is a moderated event, and it allows participants to be engaged with others either at the same time or maybe not necessarily at the same time. And it allows flexibility and convenience and participants time to reflect about their responses and to digest the dialogue that's happening online. And this, again, can be a really useful tool for groups that are hard to get together in a physical location. And this can help save money. For example, if you're doing a focus group that includes, you know, participants from all over, or maybe it's a parent of a child that has, you know, chronic illness, and they're, you know, not able to take time to come to a focus group. Another type of qualitative methodology is what's called a personal narrative. So narrative research approaches utilize the written and or spoken words or visual representations of individuals. And personal narratives allow a focus on individuals' lived experiences by giving them the ability to share their experiences in their own voices. And a personal narrative qualitative research is generally focused on the story of a single person to really go in depth with a particular phenomenon. One newer type of qualitative method is called photo voice. So photo voice is a very innovative and wonderful way to be engaged in qualitative research, and this is a process by which people can identify, represent, and enhance their community through photographic techniques. So often photo voice is embedded within community-based participatory research methods, and it's a great complement. And there's usually an element of social change or justice that's associated with photo voice. So what it is participants use cameras, and the camera acts as their recorders. And people are posed a series of questions, or they're asked to take a photo to represent what health means to them, or what a particular topic or phenomenon means to them. And then these images are usually accompanied by stories. The stories can provide evidence to promote an effective. So. Again, we just did a broad overview of qualitative research methods. Again, this is not a completely inclusive list or coverage of topics. And again, like I stated earlier, as technology emerges, as we come up with new methods, this will definitely be changing the field of qualitative research over the years. However, the foundations and principles will likely remain the same. So qualitative research, again, as with any sort of type of research, there are strengths and limitations. So qualitative research is a strong method because it allows a richness of data and deeper insight. It's a very complex phenomenon in people's lived experiences. However, because we live complex lives, the data that is gathered for qualitative research can be a challenge to analyze. A lot of this is because there's not necessarily fit categories in which findings can be fit into, and the analysis process takes quite some time as compared to, creating a logistic regression model, for example. Another strength of qualitative research is its ability to complement quantitative data. So again, quantitative data can tell us what and how many strengths of relationships. However, it's not necessarily going to tell us the why or the how, things exist. And so that's where qualitative can be complementary. However, qualitative research is not, the findings are not generalizable to the larger population. And so again, that sort of limits certain inferences that can be made. And for qualitative research, because there are multiple methods for gathering data, this can be a great opportunity to discuss very sensitive health topics with populations and people, and it allows people opportunity to share their stories and experiences in a different way than a data set can do. So data collection can be extremely time-consuming. However, we like to think that it pays off in the end. Qualitative research is also a strong method because, I'm sorry, it's not a method, it's a strong approach because it can be used to create explanatory theories. So again, that kind of goes back to qualitative research can help us to understand the hows and the whys. However, you can't do hypothesis testing in the same manner as which we do in quantitative research. So lastly, qualitative research is a very important tool to promote public health. So it can help us to inform health equity research and practice by providing critical insight into the subjective meaning of health. And again, it really helps us to get at that lived everyday experiences of people and individuals and communities. Qualitative research also allows opportunities to explore new questions and significant health topics. Again, as humans, we evolve, we change, and so our health evolves and changes, and qualitative allows us to examine that in interesting and meaningful ways. Qualitative research also allows us as public health practitioners to identify factors that are the most important, to the people whose health we seek to improve and whom we serve. Qualitative research is also important to promote public health because, we have this ongoing need to find more effective strategies of disease prevention and health promotion. Chronic disease rates continue to be a huge problem in the U.S., and not just chronic disease, but all sorts of health issues. And then qualitative research also allows us to understand complex health issues because we are able to contextualize situations and the knowledge in which people operate. So thank you so much. Now we'd like you to go to quiz M2 Unit 1.